You may be wondering if collaborating with residents and those closest to them, such as family members, to actively work with you and staff in preventing and controlling infections is feasible. And if so, how can you support this collaboration? In the last lesson, it was highlighted that high-quality care, which relies on respecting resident rights, cannot be reached without appropriate infection prevention and control. As nursing home community leadership, quality care and improving quality is a major goal. Primary process improvement priorities likely include strengthening infection prevention, quality care, as well as resident rights. In particular, with the implementation of CMS Phase 3 guidance, the regulatory expectations regarding these process improvement priorities have become a focus, including involvement of residents and their representatives, such as family members. Per CMS, facilities must identify improvement activities, and these activities must prioritize a resident's autonomy, choice, and quality of care. In addition, CMS states that each facility must establish and implement written policies and procedures for feedback. Feedback must be obtained from direct care staff, other staff, residents, and resident representatives. Lastly, a facility must also track medical errors and adverse resident events. Adverse events are classified into 3 categories of commonly preventable events: medication, care, and infection. Infection-related events include respiratory infections, skin infections, and infectious diarrhea. Again, CMS stresses, as part of the facility's performance improvement activities to reduce medical errors and adverse events, feedback and learning must be provided throughout the facility. Educating staff, residents, resident representatives, and family members on medical errors and adverse events, such as what to look for and preventative measures, are important factors in reducing and preventing medical errors and adverse events. So as a nursing home community leader, it is clear that resident and family collaboration in infection prevention and control is not just a goal, it also helps meet regulatory requirements. So how can you support collaborative infection prevention in a nursing home community? As a nursing home community leader, you can promote education of residents, those closest to them, including family members and nursing home staff, regarding quality care, resident rights, and infection control. You can also promote engagement to discover how infection prevention control is monitored and implemented in the nursing home community. Lastly, you can empower residents, their families and representatives, staff, and other resident advocates through your support to work together to strengthen infection prevention and control in the nursing home community.